All right. Well, your first speaker is Kimberly, I don't want to say this wrong, Grenowitzki. She is a licensed pediatric occupational therapist with specialty certification in feeding, eating, and swallowing, an international board certified lactation consultant, and a certified neonatal therapist based in Michigan. Kim supports families with evaluation and treatment of feeding and swallowing challenges in infants and young children, including those with extreme prematurity, cancer/blood disorders, congenital heart disease, and other health conditions. For more than 15 years, she has worked in both home settings and leading medical institutions, including Children's Hospital Los Angeles and Lucille Packard Children's Hospital Stanford. Kim earned her doctorate in occupational therapy from the University of Southern California. As a mom of two young children, Kim is passionate and advocate for research and education that helps bridge the gap between pediatric healthcare and families' journey with infant feeding, from birth to solid food for family meals. Your second speaker is Carrie Rappaport. She is a mom of two. She specializes in family mealtime dynamics and eating issues across the spectrum, from, from breastfeed and bottle feeding challenges and picky eating to dysphagia, tube feeding, and complex food refusal. Carrie is a pediatric occupational therapist and international board certified lactation consultant with extensive experience in the evaluation and treatment of normal and abnormal pediatric feeding and swallowing. She has been in a clinical practice for over 20 years and has a wide range clinical experience in a variety of settings, including pediatric outpatient clinics, inpatient hospital work, in-home private practice, as well as rural primary care and federally qualified health center. Together, Carrie and Kim co-created and launched a successful continuing education business in 2017, offering both in-person and online courses on topics such as breastfeeding, oral motor skills, swallowing, and selective eating. Their courses have been featured in clinical training programs at Stanford University, the University of Southern California, California Children's Service, and numerous pediatric therapy clinics across the United States. Today, these courses serve as a foundation for Solid Starts Pro and its global pediatric community. So before I pass it on to them, there is a very special incentive for your attendance today. You will be receiving a Solid Starts book for babies, generously donated by Carrie and Kim. To save some time today, I'll be sending an email with pickup details after this webinar, so just be in the lookout for that email. Please note this is only for those, sorry. This is only for those attending today. So like I mentioned earlier, please make sure you sign in the chat box. We will be using that as our attendance sheet, and that's how we'll know that you attended today's webinar. So just wanted to mention that. And with that, I've spoken a lot. I'll pass it on to Carrie and Kim, our speakers for today.
Hi, everybody. We are really excited on here.
Hi, everyone. Thank you, Jennifer, for the warm welcome. We're excited to be here.
All right, so where is play from start? Okay, we can see everything?
Yeah, looks good to me.
All right. So today we're going to be talking specifically about starting solids and doing that in a baby-led way, or allowing the baby to take the lead, no matter how the family would like to start in terms of the type of food. And we're going to go through, let me just show you the objectives here. Well, quickly, we need to disclose that we do have financial relationships with companies that we currently work for, and for companies work over the last 20 plus years and our research within this topic area. So I think that Jennifer gave both of us a beautiful introduction. We don't need to talk anything more about who we are, but we've been teaching on this topic for a really long time. We prefer to be low key. If you have questions, we are happy to answer them. We can jump around if things seem to be muddy in one area and you have lots of questions about that area. So just like we said, I'd like to keep this really low key and make sure that everyone feels really comfortable when we walk out of here today. So quickly, the things that we're hoping to touch on are all of the basics when it comes to starting solids. So we want to talk about developmental readiness and what we're looking for in a baby to show that they are ready to start solids. We want to talk about safe seating options, and that doesn't have to include a high chair. We have some opportunities or we can share some opportunities how families can use their lap and other areas around their home to make sure that their baby is safe. They don't have the budget or the space for a high chair. We will talk about finger food specifically because we know that this is a hot topic that a lot of people have questions about, especially when it comes to should be less scared about choking than we all might be right at this moment. We're going to go through the basics of allergen introduction. Full disclosure, Carrie and I are not pediatric allergists, but we have had the incredible opportunity to work with some unbelievably skilled allergists. And our partner at Solid Starts, Dr. Sakina Bajwala, has educated Carrie and I on all of the basics and everything that you guys need to know to help the families that you're working with. We'll talk about foods to avoid. We'll talk about choking hazards. We'll talk a little bit about schedules, which isn't on here. And then we're going to share free and low cost resources that you can share with families to help them along the way. Again, if there are questions that come up that seem like there's something we want to dig deeper into, just let us know. We are happy to do that. And we hope everyone ends this feeling more comfortable with this topic.
All right, so let's start by talking about readiness. What does it mean for a baby to be ready to start solids? There has been a shift in the medical community in terms of when a baby is considered ready over the past 20 years. So we've been teaching this for a long time, and there's been a lot of changes as new research has come out. So some of you who have been doing this for a long time, or maybe had your own babies more than, say, 10 years ago, you might have done this a little differently. But at this point, most of the medical governing bodies agree that rather than looking for a certain age to start solids, so often we hear parents say, oh, my baby's 6 months, they're ready to start solids, or oh, my baby's 4 months, and my doctor told me it was time to go ahead and start solids. The recommendation now is really looking for baby to show a certain set of skills that tell you that they are ready to start exploring solid foods and learning to chew and to eat. So for most babies, those skills, and I'm going to list them in just a second, show up around 6 months old. Are there some babies who show developmental readiness a little earlier, closer to 5 months or even 4 months? Absolutely.